Welcome, everyone. This is Mayor Steve Haggerty, and you are joining the City of Evanston's Coronavirus Q&A. Thank you for spending some time with us today. This is being broadcast live on Channel 16, the local television station, as well as on Facebook Live. If you are on Facebook and you have questions during this show, please go ahead and put those questions into the comment bar, and we have someone from the city staff who is monitoring that and will feed those questions to me. I am delighted today that we have two of the folks that are really leading our effort here as a city on this pandemic response, and that's our public health director, Ike Ogbo, and his deputy, Greg Olson, who is also our operations chief in the Emergency Operations Center that has been active for over 11 months now. Activated that on March 15th of 2020. So we have two terrific people that are with us that have been involved in this process from day one. We have literally 4 pages of questions. I don't know if we're going to be able to get through all these questions. I'm going to ask both of our guests to keep responses brief. And then if something's not being answered and you're watching this and you happen to be on Facebook Live, go ahead and put that in and we'll try to get further clarity to those questions. If we don't get through them all, I know there's a lot of interest on vaccinations. We're all anxious to be vaccinated. We will hold another coronavirus Q&A in the next, shortly after this, in the next week or two, to help people answer more questions. With that, the only other thing that I want to start off with is thank you for your patience. If you're out there and you haven't been vaccinated, and the vast majority of folks have not been vaccinated, yes. If you have been vaccinated, I want to thank all the folks that have written to me and to others in our city to tell us what a positive experience it has been once you actually get registered and can go into the point of distribution and get vaccinated. Our city staff, led by the two men that are with us today, really have done a terrific job. And so as on behalf of everybody here in Evanston, I want to thank you, Ike, and you, Greg, for all the work that you and your entire team, and that team is a multidisciplinary team and includes our facilities and logistics staff here at the city, includes our firefighters who are serving as EMTs and putting needles into the arms. It includes folks from our city manager's office, from Parks and Recreation, all around the city. This is a real team effort. So thank you for that. Our philosophy and our approach in Evanston, I want to reiterate up at the beginning, is to vaccinate, start in phase 1B, which is a huge phase. There are probably 20,000 people in phase 1B. So to start with those that are at the highest risk, should they get COVID-19, of having severe complications of that, ending up hospitalized and worse, becoming a fatality because of this virus. We know, scientists know, that those most at risk are over the age of 65. And the older you get, the greater the risk is to you. So the approach of our public health department in our city, with the limited supplies that are out there, and I will tell you the supplies continue to be limited, not just for us, but across the country. I do believe from the conference calls that I sit in at the state and the federal level that we are going to start to see those quantities increase. I do believe that. Now, I've been saying that for a couple of weeks, and we haven't necessarily seen the quantities increase, but I think we're going to see it, and we're going to see points of distribution not just be the city of Evanston. We're going to see it be the pharmacies. We're going to see it become our healthcare providers in our community, which will be good for all of us. But our approach is those most at risk with the limited quantities that we have, we want to vaccinate first. So this group started off with 85 and above, and then has been decreasing that number. And so yesterday they had an event, it was 78 and above, and I believe one coming up this week may start with the 75 and older group. We'll let our public health officials talk about that. And we are just sort of working down from there. If we had large quantities of vaccine, we could potentially run parallel events where we are, vaccinating 65 and older, where we're vaccinating teachers, vaccinating grocers, all of those essential employees that we have out there that are also part of 1B. But for now, we are focused on those that have the greatest likelihood of complications should they get COVID-19. All right, so I just want to start off with that. Lots of questions, you two, so we're going to get right into the questions. First question was from 3 different people, Casey, Faye, and Ken, and these first set of questions are about the vaccine supply. Why is Evanston going so slowly? Cook County is already vaccinating any age person in phase 1B. And along with that question, I get emails, I know you get emails that will say, somebody my age in another state was vaccinated already. How come I'm not vaccinated? Or I know people in Cicero, and everybody in Cicero over 65 has already been vaccinated. And so if you could talk to that as well. Let's start off with our Public Health Director, Ike Ogbo. Welcome, Ike.
Well, thank you, Mayor. To address the question, we've actually started vaccinating various groups in 1B, and as you indicated during your early session, that we have upwards of about 20,000 individuals just in 1B. So it will take us a while to get everyone vaccinated in 1B, especially when the vaccines are extremely limited. But I saw that to say we have vaccinated a number of age groups within 1B, because 1B also consists of our firemen, our police officers, our critical workers, and of course, we've started vaccinating our elderly. And as you mentioned, we started vaccinating the oldest amongst our oldest population. We're working our way down. We're going to have another event come Friday that will be focused on those who are due for their second dose, and some individuals who are 78 and above. And we're working our way down. So if vaccines become heightened, where we're getting thousands of vaccines, we, like you mentioned, will have parallel vaccination events. That's the plan that we are going to put in motion. But as it stands, the vaccines are quite limited, and we're vaccinating those in 1B. We've already done our first responders and our firefighters, and now we're doing our elderly, and we'll eventually start doing congregate homes and other essential workers. So we're asking everyone to exercise some patience as we work through the process. Any and anyone who is interested in getting the vaccine will eventually get one, but we are prioritizing our vaccines at this point.
Thank you, Ike. So what I want to stress is the slowness that people may feel out there is not because of the city's capacity to get needles into the arms of people. It's not because we're sitting on a huge supply of unused vaccines in our city. It's due to the limited number that we have been getting from IDPH. Next question from Sharon and Ken. I'll ask this of you, Greg. Does the city have any idea when vaccine doses will increase? I have this question too, so I'm going to have a name to Sharon, Pat, and make this Steve. You're in regular contact with IDPH, Illinois Department of Public Health, multiple times a week. So yeah, if you could illuminate this for folks, that would be helpful.
Yeah, so Mayor, I think you touched on this a little bit earlier, that the vaccines that were allotted is based upon the state's numbers. So we are not allowed to order vaccines at this point because they're so scarce and limited. Every week, the state of Illinois reaches out to us and says, hey, Evanston, this is how many doses of vaccine we can send you. Until supplies increase at the state and federal level, we will continue to see our weekly allotment being directed to us from the state. And we've been told, in a couple weeks, our vaccine supply will increase. And the state is in the same predicament where they are, their supply is determined based on the federal supply. So once the federal supply increases, it'll get more into the state, and then the state can divvy up more amongst the many different local health jurisdictions. So like the Ike and the mayor said, we have plans in place when we get all the vaccines, but we can only go as fast as we're given. So
Ike, the natural question after Greg's response there, and Susan has this question, I have this question, and I'm sure many people do. How do we know that Evanston and Illinois, the state of Illinois, are getting their fair share of vaccines? Because these vaccines come down from the feds to the states, and then the states allocate them to all of the different health departments, the pharmacy, they're allocating some to pharmacies and everyone else. Can you take us through that process and how that works and how we can have some level of assurance that, we are getting our fair share?
Yeah, absolutely. So vaccine allocation is pretty much based on population size. And as Greg alluded to, we can't order our vaccines. They let us know how many vaccines will be apportioned to Evanston. I, as a matter of fact, was on a call with IDPH this morning, and they are hoping that in the next 3 to 4 weeks that we will see an increase in vaccines. We haven't seen an increase in vaccine yet, but we are hopeful and being optimistic that in these upcoming weeks there'll be an increase. We're pretty much at the mercy of the state at this point, but as vaccines increase, we'll see the increase. And what I want to send as a message is IDPH, the city of Evanston, are very committed to get everyone vaccinated in Illinois. So that is their goal. We understand there are a number of things that need to be worked out logistically and availability of the vaccines. But once those things are sorted out, we'll start seeing hopefully thousands of vaccines here in Evanston. And we're working all together that when we start seeing an increase, that we will work expeditiously to vaccinate Evanston residents. So as I keep saying, let's just exercise a little bit of patience. I know a number of us are anxious to get the vaccine, but when the vaccines are available, we do have that capacity to vaccinate individuals.
Thank you, Ike. I have asked that question just so everybody knows, not just on this coronavirus Q&A. I have been asking that question of Ike, of Greg. And just to summarize what Ike said is we have no indication that the city of Evanston is getting, less vaccines than other places. Okay. We have no indication of that. I have spoken with our state elected officials about this specific potential issue. And so our state senators, our state representatives are all very much, alert to this as well. And again, we have no indication that we are somehow getting a share that is less than our proportional share to other communities.
And one more thing, Mayor, we're actually in a better position than other jurisdictions as well, even though our vaccines are quite limited. And as I mentioned, it is all determined by the state and our population size. But as we advance in our vaccination period and process, we are hopeful to receive as many vaccines as possible.
Thank you for that, Greg. And I will tell you, I feel blessed, and I think we all should feel blessed that we live in a community that has a public health department. There aren't many communities that have their own public health department. I think there's only 4 or 5 certified public health departments at the municipal level in the state of Illinois. We are one of them, and we are the oldest one. So we have had this for over 100 years. So that pandemic in 1918, it was the same Evanston Public Health Department that was taking the lead on that. And that is making a big difference, even though we may say, oh, well, why don't I have the vaccine yet? It is going to, it has been, and I think will continue to be an advantage that we have as a community that we've invested in that. Question from Alan, Irv, Len, Jack. I think we sort of answered this. Is there a schedule of the quantity of vaccines that you will receive? So, Greg, maybe you could talk about what kind of advance notice do we get of the vaccines we'll receive, and then do we put the second dose aside, or assume that the required second dose will be sent in time? Does the state monitor and keep track of that?
So kind of how I mentioned earlier, the state of Illinois reaches out to us every week. So it's on a weekly basis that the state tells us how much doses we will be getting. They were trying to get it on a more regular schedule, so it's every Monday, so we can properly organize and set up our pods, our point of dispensing. That day has kind of shifted around a bit, but it's basically every single week we're notified of how much and when we'll be expecting the vaccines. Regarding second doses, this is an area that the state has been incredibly consistent on so far. From the get-go, the state said that we will not be required to order second doses, and they are telling us not to hold on to vaccine to ensure a second dose because the state will be sending us second doses automatically. So there's no ordering system for second doses. So if we're using the Moderna vaccine and we get 500 doses on day one, in about 3 weeks, the state will automatically send us another 500 doses that would be the second doses for that first day. And that's in addition to that week's initial first doses. So that's the second doses. There's not a worry here in Illinois because the state has been and will continue to send them to us automatically.
Thank you, Greg. What I would tell Alan, Irv, Len, and Jack who asked that question, one of the big problems, right, is forecasting. So if we could forecast better and know exactly how much, we're going to get, we could schedule more in advance, right? Right now, literally, the health department waits to know how many of the vaccines they have or doses they have, and then they put the registration out, and they quickly put this together in about 72 hours. And I can tell you from calls with the Biden administration and other mayors around the country, that is the plan. The plan is that we will be able to have a better insight into how many doses are coming down the supply chain, and then we can have more advance notice of the events that we're setting up with our residents. Last question in vaccine supplies is from Jim. The state, county, and city all have budget issues. Has this impacted vaccine distribution? Jim, I'm going to take this question. You're right. There certainly are significant budget issues all across this country with municipalities, counties, and states, and I'd even say in with the federal government. But that is not, I want to be very clear, that is not affecting our ability to distribute vaccines. The only thing that's affecting that ability is the supply. There is aid out there in the last aid package, potentially in this new aid package, if one comes down, for vaccine distribution to get that out. Again, part of that aid is paying these pharmaceutical companies that are producing all this vaccine. When you go into one of our community centers and your time is up to get vaccinated, you do not have to pay for that. You don't have to provide an insurance card, all of that. Now, that may change if you go to a pharmacy or to your doctor, your healthcare provider. In that case, maybe that does happen. So there's a lot of aid that's out there for vaccine distribution. So it is not affected by, the budget challenges that cities have. We're going to move to the next section, which is city vaccination plan and priorities. First question is from Denise. Ike, I'll throw this over to you. How will seniors in assisted living and affordable housing facilities be vaccinated? This is something we spoke about yesterday at the Emergency Operations Center, and it'd be good to share with the audience.
Yeah, absolutely. So we do have a number of senior living facilities who are in partnership with CVS, Walgreens. This is a federal arrangement where Walgreens or CVS deploys a number of their staff to vaccinate individuals in our congregate homes. But there are a handful of them that are not engaged in this program. And as a city, we are going to be vaccinating these individuals on site. As early as next week, we're proposing to start vaccinating those who do not have this engagement with the CVS or Walgreens partnership. The reasons why a number of them were not connected to CVS or Walgreens is still unknown to me. I haven't been able to get a straight answer, but we are going to prioritize these individuals. And one thing that I also want to mention, that residents or staff at these various congregate homes can come to our sponsored vaccination events at the Levy Center if they qualify, of course, for the groups by which we are vaccinating. So if they are able to drive themselves, if they're able to come to the vaccination events, they can. They don't necessarily have to wait for us to come and conduct their vaccination events. But it is something that we are going to be prioritizing in these upcoming weeks, to go to where they are and vaccinate them. And it is more tailored to individuals who are pretty much homebound or bedridden or have some medical complications that would debar them from leaving the premises. So this is something that we are offering.
All right. Thank you, Ike, for that. Again, just to recap, we've got a lot of congregate seats here in town. We were under the impression all of them were going to be handled by the pharmacy agreement, which was Walgreens, CVS, and others. And recently found out that there were a handful that were not. Our public health department's working quickly to try and get those facilities vaccinated. There was a question here about public housing facilities, of which we do have some here in Evanston. I spoke with Rich Minocchio yesterday, who's the head of the Housing Authority of Cook County, to confirm that the two facilities that we have here, one on Noy Street and one on Sherman, are included and have dates scheduled to be vaccinated. So that's positive news. I'm going to go now to a couple of questions that people have asked that are watching this. Tony asked a question, Greg, will those 65 and above with health conditions be prioritized over healthy 65-year-olds?
So that's a good question. So we've been following closely the state's phased approach, and they take health high-risk medical conditions into consideration in phase 1C. So as of right now, we're prioritizing solely based on age, according to the state's phased approach. But one thing that we need to be cognizant of for the COVID-19 response is that we need to be flexible at all times. So these considerations could change. The state the state changed the phase 1B guidance from what the CDC says. So we'll see as vaccine becomes more available, but until then, we'll continue to follow the phased approach as the state says.
Thank you, Greg. I would just add, it gets a little tricky if the city were to get into people's personal health situations. Your doctor and your medical providers have that. And so if we do see vaccines going to health institutions, I wouldn't be surprised that they're taking that approach. Because they have the medical records and can do that. The city of Evanston does not, nor does the city of Evanston, because of HIPAA laws and everything else, want to move into that situation. We had a question here from Sarah. I'm going to take this. It says, Governor Pritzker just pulled vaccine doses from pharmacies because they were moving too slowly. Will this benefit Evanston? So, Sarah, I'm not aware that happened. Maybe our public health officials here are. Certainly, if there are less, if they're pulling doses from one place, I would think, yes, they're going to come to other places. And I would think that would mean potentially more doses for municipal public health departments or county health departments. Ike, are you aware of any change here with Governor Pritzker and pharmacies?
No, I mean, my understanding and the last that I heard is that the state is trying to increase vaccine output through various avenues, and the pharmacies being one of those avenues. My understanding is also that our allocation will not be affected by this. So, for example, if we have 5 pharmacies in Evanston, that the state will give them their allocation and continue to give us our allocation, and our allocation will not be affected. Maybe this is just news that just came out maybe a minute or two ago, but the latest that I know of is that the state continues to work with pharmacies across Illinois to disperse these vaccines.
And again, they are getting their vaccines directly from the state. Is that correct, Ike?
Yes, they are getting the vaccines directly from the state.
Thank you. And then one more question from the Facebook group, and then we'll go back to the other questions submitted beforehand. Gail and Wendy had asked, Ike, how many vaccines has the city administered so far, and how many do we receive each week?
So we provide an update on a weekly basis on the city's website. Actually, I have to do my calculations to see how many we've received so far. but it's actually approaching, I would believe, 8,000 or 9,000 doses that we receive. But we also have to keep in mind that a portion, I would say a significant portion of that has gone to our hospitals. We do have 2 hospitals that have received vaccines, and the rest has come to our department. But I'll have to do my calculations just to see exactly how many vaccines that we have received. But also, let me add this, we're going to be hopefully displaying how many vaccines we've administered and the groups that have received the vaccines and the days in which the vaccines were received on a dashboard on the city's website. I'm hoping that that will go up tomorrow or early next week. And that will give our residents and others who care to know how many vaccines have been administered and the groups that have received the vaccine. It will be similar to our COVID-19 dashboard, and I believe that's very informative, and people really appreciate that we put that dashboard in place. So we will do it the same way we have, or similar to the COVID-19 dashboard with our vaccinations.
So where can people find that, Ike?
So it's not. I mean, the situational report on our city's website, cityofevanston.org. We do have a vaccination page that pretty much talks everything about vaccinations and how we have proceeded in our efforts to vaccinate. In regards to weekly updates, those go on the website every Thursday. So there should be a weekly update by the end of the day on our website. They can find all information pertaining to our efforts in regards to vaccines on that page.
Great. Thank you, Ike. So again, that page, cityofevanston.org/vaccine, will bring you to the page, and you can see this information. We are going to be getting a dashboard up there. It's not quite done yet, but similar to what we did with COVID-19, we're going to put data out there so everyone can follow that. All right. Question from Lisa. How can those who need an in-home vaccination schedule an appointment, Greg? It's a great question.
We actually recently put a questionnaire survey on our website. It's at that cityofevanston.org/vaccine. If you scroll down, it's titled In-Home Vaccination Request. And this is really geared towards individuals who are homebound, who have mobility issues, and they're unable to come to one of our pods. We have a survey that you can fill out, basically asking if you're interested in the vaccine, whether, get some contact information, your age, any special accommodations that are required. And also, there's, Evanston's filled with a lot of nice neighbors out there looking out for each other. So if you're filling this out on your neighbor's behalf, we ask that you put your information in there as well. So if there's any issues or any questions that we have that come up, we can contact you. But we're putting together basically a task force. So our vaccinators will be going out into the community to vaccinate these homebound individuals.
Thank you, Greg. I appreciate that you emphasized right there helping your neighbors. Our entire approach to this disaster and this pandemic is whole of community response and recovery. And that means we all have a part to play to take care of one another and to take care of our community. So one of those is if you do have an elderly neighbor, please connect with them. Call them up. Find out if they've registered yet. If they need us to come out and administer the vaccine with them. And again, go to the vaccination page that we talked about. Question from Elizabeth, Emma, and Kayla. Ike, I'll throw this to you. What kind of documentation do you need from immune-compromised individuals? How do we know we are part of this group?
Oh, absolutely. How you know you're part of the group is we will notify you when it's your turn for a vaccination event. And what we have been strongly encouraging every Evanston resident and those who work in Evanston is to complete the vaccine contact form. That way, we're able to sort data and place individuals in various priority groups. So that's what we are asking individuals. So you did mention, Mayor, that we are not going to go into business of asking for medical information. So it's not something that we are currently going to ask. when it goes to 1C. So the individuals with the medical conditions, they are in group 1C from 16 to 59. And it's not something that we are going to be asking at this point. We are hoping that people would fill out the form, indicate, whether they have a medical condition or also, and we'll just take it as is. Because keep in mind, everyone will eventually get vaccinated, although we're trying to prioritize it at this point. For us, it is not information that we'll be asking individuals when it comes to our vaccination events.
Thank you, Ike. Jamie had a question. What, if any, consideration is being given to parents and caregivers of children receiving treatment for life-threatening illnesses? Will they be prioritized? Greg?
Yeah, so actually the state of Illinois about, I think, the end of January, put out a statement saying that parents of children who have certain medical conditions are qualified in phase 1A as a healthcare provider. It's not an exhaustive list, but it includes children who have Down syndrome, epilepsy, cerebral palsy, or if they require any sort of specialized healthcare needs like ventilators or oxygen. Those parents are considered phase 1A. And the state recommends, in order to determine any sort of eligibility, it would be to just present any sort of medical documentation that qualifies the condition of their child. It can be a note from your family doctor or anything like that, but parents of those children do qualify for phase 1A.
Great. So thank you, Greg. That begs the question, Ike, if I have a family and one of my children is compromised here and we need to get him or her vaccinated. You're on phase 1B right now. I was supposed to be in phase 1A. I didn't even know this until watching this coronavirus Q&A, and Greg just said this. How do I quickly get in, because I'm clearly part of a group that should have been done in the prior phase?
Absolutely. So that's why the vaccine contact form is very important. It is a form that we review on a regular basis because we know that even though we've moved into 1B, that we will still have constituents of 1A.
I cannot hear you, and Patrick can't either.
I'm sorry, can you hear me now? Okay.
We can. So if you'd start over the response again. You've got.
It seemed like you were hearing me. Okay, absolutely. So the vaccine contact form is very important. Even though we've moved to phase 1B, there are still a number of individuals who are in phase 1A who filled out the form later on. We review the form on a regular basis, and we continue to add individuals to our events and subsequent events who qualify for 1A. So if a caregiver submitted the form, let's say today, and we have an event, let's say on Friday, because that person is in the priority group 1A, we will add that individual, of course, if there's a spot left, to the event for Friday. So that's the way we have been navigating this, Mayor.
Okay. All right. I'm going to ask you another question. This is from Joe Ellen and Pat Ike. Assuming that vaccinations become available through pharmacies and your your medical providers, will the city also still continue to do mass vaccine sites?
Absolutely.
Vaccination events?
Absolutely. We are looking for various ways and opportunities to get vaccines in the arms of many, through hospitals, through Walgreens, through various pharmacies, and through our vaccination sites. So we will continue to conduct our vaccination events as long as it takes.
Okay.
Absolutely.
Thank you. We have a question here from Kerry. I'm going to go ahead and take this one. Kerry asked, can Evanston residents be vaccinated at Cook County mass vaccination sites like the one in Tinley Park? So Kerry, I was on a call this week with President Preckwinkle and her public health team, and I asked that specific question because I've gotten it from others here in Evanston. And I can, or Greg, confirm if I'm misstating this, but what I was told on that call is that because Evanston has its own public health department, certified health department, the county is not taking Evanston residents in their process. That said, if you're an Evanston resident but work in, I'll just use Wilmette as an example, you then could register and get vaccinated through the county process. Because you work there. And just like, again, in Evanston, if you work or live in Evanston, we are vaccinating you. Same with Cook County is my understanding. If you work or live in Cook County, you will be vaccinated. What I would suggest to people is if that is your situation and you work somewhere else in Cook County, you can register, and I would register with the county as well and see which one comes up, quicker for you to get a vaccination. Ike, is there anything you want to add to that?
No, you hit the nail right on there. Just a few weeks ago, I was in communication with the director for the Cook County Health Department, and they were seeking ways in which to convey information of residents who have filled out a Cook County form, because they're of the same notion that you expressed here, that we should be vaccinating our own residents. So if you are an Evanston resident, and of course, if you work in Evanston, we will be vaccinating you. But as we go along in our vaccination efforts, I believe there will be a time where any jurisdiction would take anyone to get vaccinated, irrespective of where you live. But because vaccines are extremely limited at this point, they are prioritizing those who live or work in a particular jurisdiction the same way that we are doing.
Thank you, Ike. Greg, Daniel asked, what can seniors do who need the vaccine but have no ability to fill out the online interest form? How will the vaccine get to those who need to be actively sought out by the city?
Yeah, so that's always the one of the bigger problems for public health practitioners is listening to and getting in contact and communication with the people who are hard to reach. So we have our staff with the Health and Human Services Department calling individuals who either don't have internet access or they tried to register online, but they had trouble doing it. We have a number of staff that are calling and registering these people over the phone for their vaccine, as long as they meet the age requirements we have right now. So what I would recommend is, you can always call 311 to express your interest in filling out the vaccine contact form. If the 311 operator isn't able to input your information into the contact form, they will let us know, and our health department staff will give you a call to get your information entered in there properly.
All right, so if you can't have trouble or can't fill out the form, call Evanston's 311. I just had a quick question from Poochie, who's watching, who asked, how often is the city holding the vaccination events? And I would just caveat again, we are prepared to hold a lot more vaccination events, but it is predicated on us having enough quantities of vaccine. So if you want to take that question, how often do we hold events?
Yeah, I think you've already answered the question, Mayor. But lately, we have been conducting 2 events a week. But if vaccines are in abundance, we'll probably have a bigger event where we will vaccinate thousands and thousands of individuals, or extend the number of days in which we conduct these events from maybe 2 to 3, or maybe go longer days, for maybe two days, make it a longer day where we are vaccinating maybe from 7 to 6 p.m. or so. So there are various strategies that we can employ if vaccine, of course, becomes in abundance for us.
Thank you. And just so the public knows, we have plans to move to larger facilities so we can process and vaccinate more people on any single day and all of that. All that's in the works and ready to go. We just need to get our hands on more vaccine. Greg, I'm going to ask this question sort of related to the other one, but what is the plan for reaching and vaccinating Evanston's homeless population?
So we've been in contact with our non-for-profit organizations. They're the one of our best tools for the ears on the ground. Speaking to the individuals we're trying to reach. So we have plans to go out to the certain facilities that cater to homeless populations to vaccinate the individuals there on site. And that I think Ike alluded to it a little bit earlier, that these plans will be happening fairly soon.
Ike, Stephen asked the question, how many people have completed the contact form, and will the city provide data for the number of residents by age group who have submitted the forms and the number of residents vaccinated in this group? I think perhaps we've answered this already, where you talked about that we are going to be putting a dashboard up to provide residents insight into, how many people in different age groups have been vaccinated. But if there's anything else.
Yeah, you're absolutely right. The last time we checked, we had about 48 to 49,000 individuals who have completed the form, but this also consists of those who work or live in Evanston. And as you mentioned, and as I mentioned earlier, we will have the information about those who received the vaccine, the groups who've received the vaccine, the dates in which they received the vaccine on our dashboard pretty soon.
Okay, thank you. Greg, question from Sharon, Enid, Maria, Nancy. When will those in the 65 plus age group be able to schedule appointments? I know we've talked about, look, there's a limited number of vaccines. I get this question a lot from people in the community. Is there any forecasting we can do for folks that would give them a sense that if you are 65, to 70, whatever the age group is right now, like when you might be able to get it?
I know everyone's sick of hearing this answer, but it all depends on how much vaccine we get by the state. If we're given a large, ample number of doses each week, we'll be able to go through the age groups a lot quicker, and then we'll be able to vaccinate the population 65 and up. But it really depends on how much vaccines we get from the state. There's a large older population that lives in Evanston, so it's taking a little bit of time to get through. But as a public health practitioner, it's a problem that we don't have a lot of vaccine, and a lot of people want the vaccine. But from the public health viewpoint, it's a good problem that so many people want the vaccine. It's just now that we need to have the vaccine in hand. So hopefully 65 and up will be in the next, I don't even want to put a time on it, but 3 to 4 weeks, maybe. It all depends on the state.
I understand how difficult it is, Greg, to put a specific time on it. I understand the anxiousness of wanting to know that. Again, I would just emphasize to people, if it may happen that you get these through your medical provider. So North Shore, Amita, St. Francis, they have contact forms on their sites. I would fill those out as well. So that you're trying to get the vaccine through different venues. And, as soon as we have more visibility into forecasts and how many we may receive, and again, this is something that Washington, D.C., the Biden administration very much wants to do. If you read their plan and everything, it is one of the highlights in there is our inability to forecast, and we need to get better at that. For all of us, so we all have some visibility into when we may get vaccinated. Ross just asked us on Facebook, will the city be hosting any vaccine events where emergency medical assistance will be available on site, such as partnering with St. Francis Hospital? Can you just share with our viewers, do we have medical assistance on site when we do our vaccination events? Who is it? How does that process work? Do they have to stick around after they've had the vaccination for a little bit to be monitored and all that?
Yeah, absolutely. So the way, and I can just give a brief process of how this all works. When we schedule an event, we notify qualifying residents or those who work in Evanston that there is an event at our part. They go through the process, they get vaccinated, and they observe for 15 to 20 minutes. And the purpose of observing is to ensure that people have not reacted harshly to the vaccine. And on site, we do have paramedics who will be attending to anyone who has an adverse situation due to the vaccine. So we do have a number of paramedics who are on site at any given period during our vaccination event to attend to anyone who has any type of reaction to the vaccine. So that's pretty much the process. And we have other precautions or measures that we put in place to ensure that our vaccination events are safe. One being the paramedics being there. The other is, of course, wearing face coverings and social distancing and making sure that the place is disinfected periodically. So yes, so in that regard, that's pretty much how the flow goes. Get your notification, go through the line, go through screening, fill out a number of forms, get vaccinated, get situated for 15 to 20 minutes and get observed and leave. But yeah, so we put those precautions in place to assure that our parts are safe.
Okay, thank you, Ike. Question from Jennifer and many other parents or teachers out there. District 65 teachers will return on February 16th. When will we have the opportunity to be vaccinated?
All right, so it is something that we have been reviewing. We've been talking about internally how to vaccinate our teachers who are going back to school. We understand that will relieve some of the tension, some of the fear of returning to school if we can vaccinate our teachers. We're cognizant of this, and we are hoping that we will have a plan very, very soon on how that will be executed. And once that plan has been formalized, we will be disseminating that information to our teachers, to the administrators on how we envision this happening. But it is in our minds, we understand that in order for schools to fully reopen, that our teachers ought to be vaccinated.
Right. Thank you, Ike. Jennifer, I would just say again, this is a supply issue and a focus right now on those most at risk for having severe complications if they get COVID-19. And the data all shows that those are, folks over the age of 65, and the older they get, the greater the likelihood of a severe complication. And so with the limited supply that we have, that's been the focus. Ideally, again, we would see supplies increase, and if supplies can increase, then the city could consider dual or parallel vaccination events where we're still doing the over 65, but also trying to hit other essential workers such as teachers and others. Greg, we'll go to you on this one. The city of Chicago has said that phase 1C will begin March 29th. Does the city have a tentative date for 1C? When will adults ages 60 to 64 have the opportunity to be vaccinated? This is a question from Jean and Scott.
Yeah, I think once we get a handle on what our weekly allotment will be, once the state gets it a little bit more uniform and consistent, I think we'll have a better idea on projections. As of right now, our weekly allotment's gone up, it's gone down, so it's really hard to project out into the future how long we'll be in phase 1B. I would just recommend to, like we've said before, fill out the vaccine contact form, so that way as soon as we enter phase 1C, you will be notified. And also, cityofevanston.org/vaccines. I think if you scroll down a bit, there's a little portion that says vaccine updates. If you click on that, that's the absolute most up-to-date information that we have regarding vaccines.
I'm gonna ask a follow-up question from Donna. When will flight attendants have access to the vaccine? Do you know what category they're in?
Yes, they are in, I can take that. They're actually in category 1B. They are amongst the group categorized as public transit, so they're in 1B. They are they are considered essential and sexual workers. And as Greg alluded to, we, for 1B, for the essential workers, we at this point cannot predict or project when they will be vaccinated. But if we get ample supplies, I think we'll be able to start vaccinating other essential workers as early as mid-March. So flight attendants, flight crew, attendants who work in the airport or classified in 1B.
Okay. How about private tutors? Are they considered essential workers? Gene had that question.
Yeah, I'll put them in that group as well because they are considered frontline workers too. They are instructors, they are teachers, so they should be in 1B.
And just so our viewers know, the framework that the city's using was developed by the CDC, and IDPH had some input into it. This is not something that the city of Evanston, sat around and devised, all of these different priority groups and everything else. There were a lot of experts involved, public health experts and other experts to define these groups up front. Let's go ahead and move to some questions about the city's vaccination events and registrations. We got about 10 more minutes before we have to jump. What company is our vaccine being provided by, Greg? Is it Moderna? Is it Pfizer? And then we had another question I'd like you to add that just came in on Facebook from Joellen. Can I get my second dose at a local hospital or pharmacy if I got my first dose at a city event?
So like I said, the state tells us each week what we're getting and how much we're getting. As of now, we've been getting the Moderna vaccine. So as supply remains limited, the state pretty much tells us which vaccine we'll be getting. So if there's residents out there who have, they've done their own research, they prefer one or the other, as of right now, we don't have that luxury to pick and choose. So whatever is available when it's your turn to get the vaccine, you can choose to accept that one. And then what was the second question again from the Facebook?
The Facebook
question.
The
second dose.
What's about the second dose? Yeah, if you got it at a city vaccination event, can you get your second dose though at a pharmacy or with your doctor?
Yeah, as long as the second dose is the same manufacturer, you can get it from any provider within the United States, essentially. You don't necessarily have to get it at the same exact event. It would be easier just for record keeping, but at your first dose, you're given the CDC vaccine reminder card, which has the manufacturer that you received as well as the lot number that you can bring to your second appointment just to verify. But if you happen to lose that card, it's okay because every provider has access to the state's immunization record database. So they would be able to confirm whether or not you did receive your first dose and that you're eligible for your second.
All right. Thank you, Greg. Ike, we had a question from Renee and Valerie. Can you talk about the safety measures that are being taken at the vaccine events?
Mm-hmm. Yeah, I think I kind of mentioned this in a previous question. We are ensuring that people wear masks. Anyone who's going to our vaccination event, we even put that in the notification to ensure that you are wearing a mask. We're ensuring that the seats are 6 feet apart. We're advising people as they are queuing up for their vaccines to stay 6 feet apart. We are disinfecting high contact surfaces. And also we have our paramedics in place just in case if someone reacts harshly to the vaccine. So these are measures that we've put in place to ensure that we have a safe part, and we'll continue to do that throughout our vaccination events.
Okay, thank you. So I think that answers the question Nina had about, is there accommodations if, you're the type that faints when you see a needle and it's put into your arm and all of that. And so the answer, Nina, would be yes, there are accommodations there and medical professionals, EMTs and others there at the site. Can you also, Anush and Rob had a question about, any excess vaccines that might be left over from an event, and how does the city have a short list, or how do they make sure that those vaccines don't go to waste? If you did a big event and 20 people didn't show up, for instance, one day.
Absolutely.
Yeah.
So we have planned strategically to ensure that we do not have any extra doses around, and also sometimes we do have individuals who show up to our event. It's not something that we are encouraging people to do, to just show up. There has to be a notification for you to come to the event. But the way that we've strategized it is to take a look at how many people we have remaining before we even start opening vials. Because the last thing that we will want is to waste any dosages. So all those dosages have been accounted for. We do not open a vial unless if we have the number who are going to be receiving those vaccines. So these are some of the measures that we've put in place to ensure that we don't have extra doses after during our events.
Okay. We had a very specific question from Sharon, and I want to make sort of a public service announcement on this. I'll share Sharon's question. Her question was, will I be able to schedule an appointment at the same time as my husband who's in a wheelchair? And so, my experience from other examples like this is the city will try to accommodate those situations. If you have a very specific question or you want to make note of this and have the city make note of this, I would recommend, and correct me, Ike, if I'm wrong, to send an email to vaccine@cityofevanston.org. That's vaccine@cityofevanston.org. If you forget and you're like, oh, is it vaccine or vaccines? Either one is going to go to a team of people that work with Greg and Ike, and they handle these kind of special one-off kind of questions. We did have a question from Laura, which I don't think it's necessarily one-off because lots of people come and go from Evanston or other places. She says, I am new to Evanston and my ID reflects my previous address. Well, you do need to get your driver's license renewed for Illinois, Laura. But will a utility bill suffice as proof of residence?
Yeah, we'll take that.
Okay.
Yes.
All right. Another question, I'll give this one over to you, Greg. This is from Scott. There have been reports of problems with line jumping by individuals being dishonest about being an essential worker or having underlying health conditions. Does Evanston have a strategy to prevent this from happening?
Yeah, unfortunately, vaccines, they're the hot commodity out there, and so people will sometimes fudge the telefib to get the vaccine. So since we are vaccinating individuals mainly based on age and phase 1A healthcare workers, what we do is when we send out the registration link every day, multiple times a day, we'll go through everyone who has signed up. And if they are not of the certain age, we will send an email follow-up asking them to qualify to explain how their inclusion into phase 1A, and that we asked if they can bring a certification that shows they're, a CNA, a certified nursing assistant, or anything like that can document how they are included in phase 1A.
Okay.
So it is something we're actively doing.
Okay. All right. The city certainly is clamping down if they see somebody that's trying to cheat the system and get a vaccine when it's not their time. I would just say, even for those instances where that does happen, again, it's better for all of us the more of us that get vaccinated. That's the end goal here, is we want to get all of us vaccinated. Laura had a question that said, how is the city avoiding long lines at vaccination events? Greg, why don't you handle this, Greg? I know people have this concern, especially older people. It's cold out. It's about to get really cold here. Are there lines of people outside these buildings? If you could share how we're handling that process.
Yeah, so We have been scheduling a select number of people per 15-minute appointment. So if our day is from 7:30 to 4, every 15 minutes we would allow. It started at 20. So that was, I think that's about the high number that we can accommodate, safely accommodate with social distancing. But with the colder weather events, if we don't want people lining up outside, we have them queue up inside as well safely. And we've decreased the number of people per 15 to accommodate for that. And then also, I would also just recommend that, show up at your appointment time. We've had a few incidents where, everyone's so excited to get their vaccine, they'll show up an hour before their actual appointment time. And, if there's others there, they have to wait. So, please just show up at your appointment time. And if you have an appointment, you will get the vaccine. We bring ample supplies for everyone who's registered.
Thank you, Greg.
And also, Mayor, for those who show up early, and it's not something that we're encouraging for people to do, we do have a waiting area, socially distanced, where people can wait so they're not out in the cold. So that's something that we also provide, but we're not encouraging people to come super early so that we can safely conduct our events.
Right. So thank you both for the answers to many questions. Unfortunately, we're at our hour point for this broadcast, and there are some questions that I wasn't able to get to. I am going to ask one last question of you, Ike, and then I will ask our behind-the-scenes city staff if they can work with your team, Ike, and we can schedule another coronavirus Q&A to answer additional questions we weren't able to answer today, as well as additional new questions that come in. So, Ike, we're going to end with this question from Mary. Why do we have to wear masks even after being vaccinated?
Because there's still a possibility of one transmitting the virus even after being vaccinated. Studies are still on the way to understand these vaccines and how effective they are. And although the COVID-19 vaccine is highly effective, it is not 100% effective. And until COVID-19 is under control, we'll continue to follow IDPH CDC guidelines of wearing a mask, washing your hands, social distancing, and all the other protocols.
All right. Thank you, Ike. Thank you, everyone, for all of your questions, for joining us today, for everything that Evanston residents and people that work in Evanston are doing to keep our community safe. We continue in terms of the COVID statistics on a comparative basis to our neighbors to the south and to the west to do a really good job here of containing and managing the spread of COVID-19. And that is because of the two gentlemen and all of their folks in the city. It's because of all of you listening and following the protocols of our public health department. So I thank you. I also lastly want to thank you for your patience. I know we are all anxious to get the vaccine, or if you're my age, you're anxious for your parents to get the vaccine. My mom, who's 77, I need to call her, but I think she got the vaccine today in Massachusetts. So I am relieved as a child to have my parent get the vaccine, and my father got it earlier this week in Massachusetts. So I understand, our staff understands the natural anxiety, but excitement that we all have to get this vaccine. It's been an incredible team effort on all of our parts, on scientists' parts, on essential workers' parts, everybody to get to this point. And if we keep together, we will get through this. So thank you, Ike. Thank you, Greg. We will see you at the next coronavirus Q&A, and we will put that out on the city's website when that will be. When that will occur. Be safe, everyone. Bye-bye.